Hello, and happy Wellness Wednesday. So, you may or may not know that we go live at 5 every Wellness Wednesday at 5 o'clock. So, this week's topic, you may or may not know that April Fool's Day is coming. So, every April Fool's Day, there's always pranksters out there that are trying to pull one over on you or joke you into thinking something silly. Now, our office takes this as a chance to provide some education. A lot of times, you may or may not have heard chiropractors as being called of as quacks. Now, I will tell you that in our office, every April Fool's Day, we have an annual duck hunt. That means the only quacks you're going to find in our office are rubber duckies. So all around our office, we have rubber duckies everywhere. So come on into our office on April Fool's Day, collect some ducks, bring your kids. We make it a fun event. And the reason is we want to educate you a little bit more about not only what chiropractic is, but some of the history and also the bashing between the American Medical Association and the chiropractic profession. So you may or may not know, but back in the 1960s, the American Medical Association tried to contain and eliminate chiropractic as a profession. They felt it was, threatening the medical profession at the time. So they actually tried to prevent physicians from referring their patients to chiropractors, and also prevent chiropractors from referring back to their physicians. They also were trying to basically eliminate chiropractors from being able to refer their patients in to get diagnostic testing like x-rays and also MRI findings if they weren't able to do that in their office. So one of the things that's really interesting is if you look back in that history, that in 1976, there were 5 chiropractors that actually filed suit against the American Medical Association, and also 20 medical specialists as well as co-conspirators and in violation of the Sherman antitrust laws. After 15 years of litigation, that means it was in the courts for 15 years, the AMA was actually found guilty. That means that they were actually found guilty of intending to destroy a competitor, and there was evidence showing that the American Medical Association was motivated by economic concerns, and they had also concealed evidence and also doctored documents. So there's kind of a sordid history between chiropractic and the medical profession, but I will tell you in our office, typically, we work hand in hand with your medical doctor. I have no problem sending notes. I have no problem calling your doctor's office to tell them what's going on, or even telling them, hey, patient's got this going on. This is not really something I treat. Can you take care of this? Can we do some labs? Can we get an eye or a second take on this to get some answers? One of the things that I find is really interesting is there are a lot of misconceptions and a lot of myths about chiropractic that I want to squash like bugs. So today I'm going to take a chance to tell you 4 myths about chiropractic that I hear quite frequently. The first one is that chiropractors are quacks. Let me remind you, the only quacks you're going to find in our office are rubber duckies on April Fool's Day. So sometimes if you're not really familiar with chiropractic or you haven't been able to experience the benefits of chiropractic, you may bash chiropractors. I also find that sometimes if somebody has tried one chiropractor one time and they didn't have a good experience, they may never think to try another chiropractor. I will tell you, there are about 10 different ways that I do chiropractic adjusting in my office. I have some patients that we do no force at all with their adjustment. We typically do more of a muscle release. I have some patients we use activator only, which is a very, very light force using an instrument. I have some patients we do more massage or exercise with. I have some patients I do drop adjusting. I have some patients that we do a little bit more heavier or more adjusting as well. So I tailor care to the person. But another thing that I always hear is chiropractors aren't real doctors. Well, let me tell you a little bit more. We're specialists. So we get extensive training in not only science and health, but also the human body. On average, chiropractor spends about 4 years getting their doctorate of chiropractic, and before that, typically they will have undergrad for at least 3 years, getting prerequisites and sometimes even a bachelor's degree. I personally had 9 years of college education, plus I do about 20 hours to 30 hours per year of continuing education towards my continuing education requirements for my licensure. So not only did I go to school for a very long time, we get training pretty much, like I said, the same as a medical doctor would when they typically are specializing in pharmacology and medications and pathology. I'm specializing more in actual adjustments and physical therapy and things like that they don't specialize in. Another number 2 myth that I hear a lot is chiropractors are your last option. In reality, when you're thinking about health issues, a lot of people have tried medication, they've tried physical therapy, they may have tried surgery, and they're like, you know what, I've tried everything, I guess I better go to a chiropractor. In reality, though, chiropractic care is more of a conservative option. So I do find that if you try chiropractic first, a lot of times before the medication or along with it, I do find some patients do great with a combination of care. I find that doing chiropractic care and conservative care with physical therapy can be a really great option. so that you can possibly even avoid having a surgery. I do have some patients that have already had surgeries done that come into the office for a second opinion because they're still having pain. About 70% of surgeries, especially spinal fusion surgeries, do tend to fail. So we have a lot of that happening in our office where patients are still having pain. And after a surgery, we do have to look at x-rays and see what exactly happened during the surgery, whether or not we can treat that area. But in many cases, if we're not able to do chiropractic adjusting, a lot of times we can do some physical therapy and home exercise programs to provide some relief and results. The other thing that I hear is chiropractors are dangerous. Well, when it comes to chiropractic injuries, they do happen. However, they're pretty rare. If you actually look at malpractice numbers and costs between a medical doctor and a chiropractor, they're about 10 times lower for a chiropractor because it's very rare that we are injuring a patient. Again, there is some risk factor for having a stroke. Typically, that's because we already have somebody that's having an artery dissection going on when they're coming in with neck pain or headaches. And without a proper examination, without really knowing what's going on and doing some exam to find out if they're at risk for that, you can have somebody that does get a stroke from a chiropractic adjustment. If you are already having an artery dissection, it doesn't matter if you go to a medical doctor or a physical therapist or even just turn your head back in your car out of parking space, you're going to have that same risk factor that the artery will continue to dissect and cause a stroke. So biggest thing I know in my office, I eliminate risk. I typically do not do those rotational style adjustments where we're twisting your neck. I do very gentle adjusting in the office, and I also do a thorough exam first to make sure you're not at risk for having that happen for you. And the number 4 thing that I hear a lot is that chiropractic is only for adults. Let me tell you, chiropractic here is absolutely amazing for pregnant women as well as babies. Let's face it, when babies are being born, there's about 95 pounds of pressure on the top of their head coming out of the birth canal, and the bones in the neck or shoulder or even the spine can twist, and that can cause everything from colic to nursing difficulties. I've also seen some kids that are having digestive issues or constipation as well. I've also seen children that have had problems with behavior or even development because their brain isn't communicating with their body properly. So in our office, I do postgraduate education. So I've done extra education programs specifically in pregnancy, specifically for children and babies. So I have a lot of different ways that I treat patients that are younger. And of course, we all know toddlers are wiggly, wiggly, wiggly. So we have to be able to kind of adjust and check things on the flow. So we do dancing hips in the office. Typically toddlers that are active, we stand up and check their hips as they're dancing to make sure that they're moving properly. And then we also have mom and dad hold them as we're checking their spine to make sure that it is not uncomfortable for them or it's not scary. I do treat patients as young as 2 hours old, and I've also had a patient that was 102. So I do treat a range of patients and ages. Basically, like I said, I tailor care to the person. So that's what I do in my office. So hopefully you learned something this week. And if you haven't marked your calendar yet, make sure you stop in our office for April Fool's Day because we will have our annual duck hunt. And let me tell you, these duckies are so cute. We've got all different kinds. So stop in, grab a duck, take a couple ducks home for your kiddos. And we will be here on April Fool's Day, which is Friday the 1st. We'll be here from 9 until noon. Have a great rest of your day, and thanks for tuning in. And don't forget, next week, Wellness Wednesday, we go live at 5. Thanks for tuning in to Freedom Chiropractic and Holistic Health. Don't forget to hit that subscribe button and ring that little bell so we'll let you know about some new videos coming out. Every Wellness Wednesday, we go live at 5. Thanks for tuning in to Freedom Chiropractic and Holistic Health. Don't forget to hit that subscribe button and ring that little bell so we'll let you know about some new videos coming out. Every Wellness Wednesday, we go live at 5.